Okay, everybody here, we got to get started. Okay. First things first, people, you got to start answering your phones. Okay. Got to get a hold of you. Answer those phones. Next, let's see. Weekend shift. You guys have got to stop putting the tip jar out. They know about it. It's a great idea, but management said no more tip jar. Okay, let's see. We've got some new policies. We're not going to go over those now, but they're lining the entire break room wall. So, you can stare at those for the next 6 months. And then we are going to go over something from our suggestion box every huddle now. Let's see. This one says, Janet keeps walking in front of me in the hall. And then when I try to turn, she'll walk that way too. And then she'll stop short in front of me. Well, that's not really a suggestion, but I guess Janet, stop walking in the hall so much. All right, you guys have a good shift. Okay, is this everybody? Let's get started. Got to get this done. Okay, first things first, bedside handoff. Every patient, every time, doesn't matter if it's COVID or TB or whatever. Just get in there and get it done. Thank you. Next is we still do not know where the smell is coming from. We cannot find the source of the smell. And if anyone does find the source of the smell, then management said they'd give you 5 hours PTO. So finder's fee, I guess. Let's see. Okay, work computers are meant for work only. So please stop using the work computers to search for other jobs. Thank you. Let's see. Next is the suggestion box. This one says, Janet is the source of the smell. Well, we actually had her sent off and tested, and the results came back inconclusive. So let's do another one. This one is just a line drawing. It's a person with a poopy on their head with some flies and some stink lines, and it says Janet. So it's pretty good. Okay, you guys have a great shift. Oh, we don't have any aides today. Bye. Is this everybody? Okay, we got to get started. Get this over. Okay, first things first. Tardiness. We've got to start being on time. Okay, this is especially for the night shift. You guys, this is becoming a real issue. People are going to start getting written up. Okay, who's night shift? Night shift. None of them are here yet. Okay. Let's see. Okay, breaks. Remember, we get 2 15-minute breaks and we get 1 30-minute break for lunch. Okay, that's it. Unless you're a smoker, and then we work around your schedule. Okay. A bladder scanner. Okay, bladder scanner is still missing. If you find the bladder scanner, please return to step down. They say they haven't seen it since October. Some say it never existed. Okay, let's go to the suggestion box. Okay, the Wi-Fi is too slow at night, and Netflix just keeps loading. For real? That's good to know because I thought it was my phone. Okay, you guys have a great shift. I'm going to go smoke a cigarette. Okay, is this everybody? We got to get started. Get this over with. Okay, so we're having an in-service tonight. It's going to be right up here at the nurse's station. It's going to take about 20 minutes, and it's going to be right smack dab in the middle of med pass. Okay, so during med pass, I need you all stop what you're doing, come up here for about 20 minutes, and learn about these new dry erase markers we're getting. They got an eraser on the end of them. Okay, remember if you have mandatory overtime this week to get it approved by Jessica. Okay, all right, ladies, the police officer that's sitting with that inmate in 402, you guys have got to leave him alone, okay? He's just up here to do his job. You guys are sexually harassing him, technically. Okay? Even though he kind of knows what he's doing, doesn't he? Wearing them shirts all tight. He's kind of asking for it, isn't he? Let's go to the suggestion box. Okay, this says, even if you've been vaccinated and you've had all your boosters, the CDC is still recommending that you stay at least 60 feet away from Janet. Nice. All right, you guys have a great shift. Epic is down. We don't know when it's coming up. Okay, is this everybody? Let's go ahead and get started. Get this over with. Okay, first things first. Oh, there's donuts in the break room, by the way. Yeah. First things first, hourly rounding. Okay, so they're changing a couple things with that hourly rounding. They actually want us to go in the room every hour now. They want us to check on the patient, wake them up, make sure they're okay. And we are no longer allowed to just initial all the way down the whiteboard at the end of the shift. Even though that's the way I was trained. I don't know. We've got quite a few new policies. We're We're not going to go over those here and now, but if you want to read over those, they are lining the walls in the bathroom, as well as the ceiling and a couple on the floor in the bathroom, if you want to read those. Let's see. Okay, so we've got a special request today from corporate. Okay, it says, in light of the recent events in Florida, the following nurses are required to show proof of a nursing diploma within the next 24 hours. Janet. Okay. All right. Well, you guys have a great shift, and those donuts are hella old. Okay, is this everybody? Let's go ahead and get started. First things first, falls. Guys, we've had 12 documented falls this week. Okay, that's a combination of patients and staff. But remember, if you have a high fall risk patient, they have to have a bed alarm on, and they have to have their door remain open at all times, okay? And my staff, you guys know we have a lot of puddles on this floor. If you don't work on this floor normally, just know this is the floor with the most puddles, okay? And they're super slippery. Thank you. Okay, Janet is out. She's sick this week. She got food poisoning. She got it from that fish stew that she brought up here to the potluck. I just want to thank everybody for not eating any of it. Just remember, it is policy. Do not eat anything that Janet brings up here. Okay? Thank you. So we know that our COVID policies, the restrictions have really become relaxed recently. And just remember that we still do have an active COVID patient on the floor. He's actually right over there. He's at the candy machine. Hey, Randy. He's a good guy. Okay, let's go to the suggestion box. Okay, it says, y'all better watch out for them puddles. I told you. Okay, well, you guys have a great shift. Just remember that they're going to be waxing the floor tonight, so it's going to be terrible. Okay, is this everybody? Let's go ahead and get started, okay? First things first, the mandatory staff meeting is still Monday morning, but they changed the time. So day shift, you guys are supposed to get here at 6 a.m. Night shift, you guys get here at 10 a.m. Thank you. Okay, they're doing away with the casual Fridays or the t-shirt Fridays, whatever you call them, because, well, you guys got crazy with the cleavage. Crazy. We have to work together, you know. I saw 3 nipples. Thank you. Okay, it's February 2nd, and Janet did see her shadow this morning. So that means we have 6 more weeks of knowing that the Joint Commission will be here any day, but not knowing which day it is and having to worry about it. So you guys don't leave your drinks on the counter. Thank you. Let's go to the suggestion box. This one says, y'all know them cameras in the hall don't really work, right? If they did, we'd all be fired. Well, that's probably true. That's got to be true. All right. Well, you guys have a great shift. Just know we're all at a normal saline.